Hey guys, so coming to you from the sort of crossover hallway. I really like this space because it's super sunny and windowy, and it kind of, show you, kind of reminds me of Grey's Anatomy for some reason. I guess it's like the beds all lined up against the window. So now we're kind of wearing masks all the time in the hospital. I don't always, but pretty much if I'm like traveling around in the hallways, or if I basically wear it like 90% of the time. Sometimes I'll take it off if I'm just doing notes or whatever, but I pretty much am wearing it all the time just because the risk of getting in contact with the COVID-19 like infected space is just too high now. The number of patients in the hospital is in the 60s today. And I believe the number of patients in Montreal has reached the 4,000s. And a lot of those patients are just at home. I'd say the majority of those patients are just at home and they're not super sick. And they're managing those symptoms fairly well. But at this hospital, we're treating the majority of the patients who are sick. And like I said, the numbers here are in the 60s. So we have 3 units that are functioning as COVID units for positive patients. We have the ICU, and then we have my unit, which is a unit that functions for ruling out patients. So we basically just keep them until they test positive or negative, and then we transfer them to an appropriate unit once we know. And soon, depending on like the numbers, but most likely our unit will become a unit for positive patients. So we'll be like the 4th unit to be converted into a unit for just positive patients. So yeah, basically we're waiting it's the calm before the storm right now. It ebbs and flows. So we'll sometimes have like 12 to 15 patients on the unit, or I think the other night we had like 16 patients on the unit. So that was quite a bit, just because even if you have like only 2 or 3 patients, it's sort of like having 4 or 5, because you and your buddy, like you work with another nurse, and everything you do, you have to do together. So your buddy's patients are kind of like also your patients, because you're doing all of the care together, because you need to be with the other nurse that you're buddied with at all times to make sure that they're safe. So everything that they do, getting dressed, you watch them and you make sure that they're not making any mistakes. And this is like a way to provide protection to each other. And it's a really good system, and I feel like it is adding an extra layer of protection, because I mean, one of the best ways that we can protect each other is to support each other and be there for each other. But it does mean that things take a lot of extra time. And so having 3 patients, when you have to take a lot of time getting dressed, a lot of time getting undressed, and being very careful and disinfecting everything, it's very time consuming. So it's not like having 3 patients normally at all. It's completely different. And so now, like the other day, the unit had like 16 patients, I think. And then today we have like none. And so it's like very, very quiet today. And I suspect that we will have a surge of patients shortly. So right now is really, like I said, the calm before the storm. So we're just sort of waiting for things to kind of pick up. So I'm just taking this time to kind of read up and try to get as up to date on the policies as I can, and to try to be as prepared as possible, to kind of get to know my colleagues more and to make some friends, since I'm new, and I feel like it's really important to kind of get to know people, and it does make the job a lot more enjoyable now that I feel like I'm starting to make connections with people. And and I'm also taking the time to kind of just I guess collect my thoughts and and like sort of energize and get ready for what's to come, because I know like we're being prepared by management for sort of like this rise in numbers. So yeah, I'm going to try to prepare for you, I guess, an explanation of how we prepare, our rooms for patients to come. Obviously, I can't show you patients, I can't show you how we care for them, but I'll try to show you what the rooms look like and how it is that we prepare for incoming patients, and how we get ready. So yeah, I'll try to show you that. Okay. So outside the room, we like to keep oxygen supplies because these patients often have trouble with oxygenation. So we keep nasal prongs as well as an FiO2 mask for patients that need more than 4 liters of oxygen, or for patients that are being transported. Keep a vital signs sheet as well as a disposable blood pressure cuff outside the room. And on the door, we have some basic equipment that we might need and a log sheet to keep track of everything that we need in the room. So when we go inside, you'll see that there is obviously a bed. We keep it made for when the patient arrives. And then we have an oxygen tank ready for if the patient needs to be transported. So it's always good to check how much oxygen is in the tank, because you don't want to have an empty tank in the room. And you always want to check your wall oxygen to make sure that it's working as well. This is your suction device, which you also need to check, which I checked earlier. I won't check it now. We use a whiteboard to communicate with the patient, so we'll give the patient a phone number to reach us as well as our names, and we'll put the date on there and any other key information that they might need. We also keep water in the room, a kidney basin, some towels, blankets, things that the patients might ask for so that we can limit how much we go into the room. We put a phone in every room for the patients so that they can communicate with their families, and so that we can check on our patients without always having to go into the room, because we try to limit our contact with these patients. This panel is the call bell device, so the patients can call us when they need something, and it is also used for us to call code blues as well as for more minor emergencies. This is a TV that the patients can use, and right now TV is free in the hospital to sort of help keep morale up as much as possible. So on your way out, we like to check to make sure that the Purell is working, because that's really important right now. We need to be able to use that when we're doffing, and we need a hamper so that we can remove our protective equipment as well as a garbage bin. And that sums up how we prepare a patient's room for when they arrive.